Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this lecture we're going to talk about the color-coded tag system and the START method used in disaster triage. And as always, whenever you get done watching this YouTube video, you can access the free quiz that will test you on this content. So let's get started. The word triage means to group or rank, and in the healthcare system we triage patients. For instance, in the ER, patients come to the ER seeking care and they will be triaged, hence grouped or ranked based on what they're presenting with, their signs and symptoms. And if they're really bad off, they will be seen immediately. However, if they don't really meet that criteria, their treatment will be delayed and the patient will have to wait a little bit until they are seen. However, in this lecture, what we're talking about is triage in a disaster situation. Because whenever you have a disaster, you have many wounded coming to you that need treatment. However, you're very limited on your personnel and your resources to treat those people, so you have to use them very wisely, and that is where triage comes in handy, specifically the color code tag system, because it's going to tell us which patients should be seen first, and it tells us what type of injuries would fall into certain colors. So for exams, what you want to know is all these colors, there's 4 of them. A patient will fall into one of them. Who's seen first, so has highest priority, and what type of injuries you may see with each color. And we use that color code tag system, but we also use a tool to help us determine which color the person will be tagged, and that is called the START method, and we will be going over that here in a moment as well. So first, let's talk about the color-coded tag system. There are 4 possible colors a patient could be tagged. We have red, yellow, green, or black. Now, to help you keep this information straight for exams, because some people get confused on red, yellow, and green, like who has highest priority, let's think of a traffic light, because with black, that's easy to remember. The color black is associated with death, and these patients are dying or have died. So with a traffic light, most traffic lights have red, yellow, and green. So think about what you're supposed to do whenever you see each light color. So when we see a red on a traffic light, what does that mean? That means stop. And so these patients who are tagged red, they are considered immediate. They need immediate treatment right there. So they are seen first. They have highest priority. And the reason is because their injuries are life-threatening. However, they are survivable possibly if we can get them treatment right then and there. And these patients are going to have severe alteration in their breathing, their circulation, their neurostatus, mental status. So they're going to have some issues, but if we can get them treatment, we can possibly increase their chances of survival. Now, what are some conditions that may have a person tagged as red? Well, think of conditions that's going to alter these things where a patient needs treatment right there or they're going to die. So think of things like severe spinal cord injuries, because our spinal cord, certain areas of it control our respiratory system, our circulation. So think of patients who are going into shock, like neurogenic shock, cardiogenic shock. Also, patients who have severe bleeding, whether it's internally, externally, but we can get the patient, get that corrected, stop that bleeding, transfuse them, we can increase their chances of survival. Or patients who have significant burns on their body. This can alter their circulation for sure, along with their respiratory status, depending on where the burn is located. Also, any type of really severe respiratory trauma where you have collapsed lungs as well. Then we have the tag color yellow. And what are you supposed to do at a traffic light when it turns yellow? You're supposed to slow down, delay, because you're about to have to stop. So patients who are tagged yellow, their treatment is delayed for a little bit. So they have second highest priority. Now, they have injuries, and these injuries are serious and significant, but as of right now at that point, their breathing, circulation, mental/neuro status is within normal range. However, eventually that is going to change because their injuries are serious. So right now we can delay their treatment because these patients up here need to be seen that are red, but it doesn't need to be delayed too long. So usually about an hour or so, but the patient needs to be seen so they can be treated so we don't have alteration in our breathing, circulation, neuro/mental status. And this includes patients who have like a major bone fracture that needs treatment, or some type of integumentary issue like an open wound, deep laceration, etc. Next is a tag color green. And what do you do at a traffic light when it's green? You go. So a lot of these patients who are tagged green, they're sometimes termed as the walking wounded. So these patients can get up and they can go. So they are considered minor. They have very minimal injuries. These injuries are not life-threatening, and their breathing, circulation, neuro status is not expected to really change. So we can delay their treatment for several hours, and sometimes these patients can actually treat themselves, so self-care. And then lastly, we have the tag color black. And black, patients who are tagged this, we consider this expectant. So they are in the process of dying, or they have died. And their injuries are so deadly to the point that they're just not going to survive. So you have absence of that breathing, circulation, neuro/mental status. So now let's talk about the START method, which is used to help us assign a tag color to a wounded individual during a disaster situation. And the word START actually stands for simple triage and rapid treatment. And this particular START method that we're going over in this lecture is for the adult patient. And it's very quick and easy to use. So the first thing what you want to do is you want to look at that wounded individual and you want to see what they're doing. Are they up, able to move, walk around, or are they unable to do that? If they are able to walk, that tells you right there that this patient is breathing, they have circulation, and they have a neuro system, mental status is there. So you're automatically going to tag that patient green. This will be the only time that a patient will be green. Now, the other part of this method is for patients who are unable to walk. And they're either going to be tagged red, yellow, or black. And you're going to be looking at three things in this particular order. You're going to be looking at their breathing, their circulation, and their neuro/mental status. So first, breathing. What you're going to be looking at is if they're breathing, and if so, what is the rate of breaths. So let's say yes, the person's breathing, but their respiratory rate is greater than 30. We know in an adult, a normal respiratory rate is about 12 to 20 breaths per minute. So if it's greater than 30, something is definitely going on with this person and they need immediate treatment fast because they are not doing good. So they are going to be tagged red. Let's say they are breathing, but the respiratory rate is less than 30. Well, we will proceed and check their circulation. But let's say they're not breathing. What you want to do is quickly reposition that airway and reassess if they're breathing. If they're not, they are going to be tagged black. But let's say, reposition that airway, they do start breathing. They have spontaneous breaths. Well, this tells us this patient isn't doing good. They're only breathing because we reposition their airway, so they do need immediate treatment. So they're going to be tagged red. Now we're going to look at circulation, and what we're looking for is a positive radial pulse, or if they have a capillary refill less than 2 seconds. Those things really tell us that our patient is perfusing, which is a good thing. So let's say yes, they have this. We will proceed and check their neuro/mental status. If they don't have this, this tells us that something is wrong, so we will tag them red. Then lastly, we're going to look at their neuro/mental status. And what you're doing with this is you're seeing if they can obey or follow your commands. So let's say that yes, they can do that. Well, we're going to tag them yellow. If they cannot do this, they would be tagged red. So let's quickly recap the START method. So a patient is only going to be tagged green with this method if they are up and able to walk around, because this tells us they're breathing, they're circulating, and they have a mental status neuro system that is working. And that's for patients who are only walking. Now, patients who are unable to walk, they're either going to be red, yellow, or black. Now, they will be red if they have the following issues. They're breathing, but that respiratory rate is greater than 30. Or if they weren't breathing at first, you reposition their airway, and then all of a sudden they were breathing, they would be red. If they don't have a radial pulse or their capillary refill is greater than 2 seconds, they would be red. Or if they're unable to follow your commands. Now, a patient's only going to be tagged black. If you check that breathing, they're not breathing when you reposition that airway. They would be tagged black. And they will only be tagged yellow if they're breathing, it's less than 30, if they do have circulation, and they can follow your commands whenever you're assessing their mental status. Okay, so that wraps up this video over the color-coded tagging system and the START method used during a disaster situation. And don't forget to access the free quiz that will test you on this content.